Welcome to Healthcare Channel. Please subscribe and share this video to help others in this way. Arthritis, a condition characterized by inflammation of the joints, can be influenced by dietary choices. While no single food can cause or cure arthritis, some foods are known to contribute to inflammation, potentially exacerbating symptoms. Here are the top 6 inflammatory foods to consider avoiding for arthritis management. Number 1. Sugar and refined carbohydrates. Refined sugars and carbohydrates have been linked to increased inflammation in the body. Foods like cakes, cookies, sodas, and white bread can cause spikes in blood sugar levels, triggering the release of inflammatory cytokines. Additionally, these foods may contribute to weight gain, putting extra stress on joints. Alternative, opt for whole grains, fruits, and vegetables to maintain stable blood sugar levels and provide essential nutrients. Number 2. Saturated and trans fats. Foods high in saturated and trans fats, such as red meat, full-fat dairy products, and certain processed foods, can promote inflammation. These fats can trigger the production of inflammatory chemicals in the body, worsening arthritis symptoms. Alternative, choose sources of healthy fats like olive oil, avocados, and fatty fish, which contain omega-3 fatty acids known for their anti-inflammatory properties. Number 3. Nightshade vegetables. Some individuals with arthritis report sensitivity to nightshade vegetables, including tomatoes, peppers, eggplants, and potatoes. These vegetables contain solanine, a natural chemical that may contribute to inflammation and joint pain in some people. Alternative, experiment with eliminating nightshades from your diet to observe any changes in symptoms. Substitute with non-nightshade vegetables like spinach, carrots, and broccoli. Number 4. Dairy products. Certain individuals with arthritis may experience increased inflammation with the consumption of dairy products. While research on the link between dairy and arthritis is inconclusive, some people report symptom improvement when reducing dairy intake. Alternative, consider dairy alternatives like almond or soy milk. Ensure adequate calcium intake from sources like leafy greens, fortified plant-based milk, and supplements if necessary. Number 5. Processed and processed foods. Processed foods often contain high levels of salt, sugar, and unhealthy fats. These additives can contribute to inflammation and may worsen arthritis symptoms. Common processed foods include fast food, frozen meals, and snacks. Alternative, choose whole, unprocessed foods whenever possible. Prepare meals at home using fresh ingredients to have better control over your diet. Number 6. Alcohol. Excessive alcohol consumption can contribute to inflammation and may interfere with the effectiveness of arthritis medications. It can also lead to weight gain, putting additional strain on joints. Alternative, if you choose to drink alcohol, do so in moderation. Consider alternatives like herbal teas, infused water, or mocktails to stay hydrated without the negative effects of alcohol. Conclusion. While these inflammatory foods are commonly associated with arthritis symptoms, it's crucial to recognize that individual responses to specific foods can vary. Maintaining a food diary and working with a healthcare professional or nutritionist can help identify personal triggers and create a tailored anti-inflammatory diet plan. In addition to avoiding inflammatory foods, incorporating a variety of nutrient-rich, anti-inflammatory foods can contribute to overall joint health and well-being. Always consult with a healthcare provider before making significant changes to your diet, especially if you have underlying health conditions.